Hey, welcome to another Tooth Talks Live. We've got another question here today, and it is really exciting for me. I'm sort of looking forward to these moments where I don't know what's coming. So hopefully this is a good one. We've got a question about teeth in this envelope, which is stuck in here because it's a sticky note. Very safe, this question. Should adults get fluoride treatment and dentist? Should adults get fluoride treatment at the dentist? Okay, got it. So we talked about fluoride and what it does, but just as a quick recap, fluoride basically swaps out an ion that turns hydroxyapatite, which is what teeth crystals are made out of, into something that's very similar, called fluoroxyapatite, with just a one switch of a molecule with an ion, the fluoride ion. And I got molecule and ion mixed up, so if you remember that, still trying to get over it. But basically what ends up happening is that with the fluoride, as part of the enamel on the tooth surface, it takes more acid to lose the minerals going out of your teeth. Now, what's important is that your teeth are like a teeter-totter. So if you had healthy teeth and you lost some minerals and we always put back just the same amount that was gone, we would never change. But that's not practical, because sometimes you forget to brush your teeth or whatever, and we're going to lose more minerals than we put in. But the next day, if you do a good job, your saliva is going to tip the teeter-totter the other way, and it's going to start to fill the minerals back up in the teeth and keep the surface nice and hard. And that's why we say brush and floss your teeth, right? So what ends up happening with the fluoride is that it basically tips your teeter-totter to the good a little bit. And the reason why it's important to talk about it in these terms is if you're already somebody whose teeter-totter is tipped all the way good, you can only get so much minerals into your teeth and you've got them all. And at that point, it's not helpful to put fluoride on your teeth. You'll still get fluoroxyapatite, which is going to help tip your teeter-totter the direction it's already going in. But if you imagine, if you're that guy, that big fat man on the teeter-totter with this little tiny toddler on the other end, the big fat man's going to win. And if that's you, you're good. You don't have to worry about it. But if you're taking lots of medications and your teeter-totter is starting to tip the other way, there's only so many things that we can practically do, and a lot of them are habit-based. Can you brush your teeth more? Make sure that you do a good job flossing. Maybe floss after every meal if you're really high risk. And it's just so easy to use fluoride. Now, there's some confusion because of water fluoridation, and that's different. When we put fluoride in the water, we're trying to get about, and don't write me letters if I get this wrong, I'm not 100%, but it's about 0.07 parts per million fluoride is what the goal is to put in your water. And if you're a little kid and you're drinking that water and it's in your bread and you make juice and everything is in there, as you develop your teeth, it's going to come pre-installed with some fluoroxyapatite crystals, enough of them that it's like having permanent fluoride treatment a little bit all the time. But if you're an adult, putting fluoride in your water at that same 0.07 parts per million is going to do nothing, because you're not growing teeth at that point. They're already there. It's not going to harm you. One of the great things that we think about fluoride, and I say we think because there's some debate over whether there's some other effects that it might have, but that the toxic dose, or the dose where we first start seeing negative effects like fluorosis of the teeth, I think that's at 0.5% or 0.5 parts per million, or it might even be higher. So the point is that you have to be many, many times higher than the recommended dose in order to start seeing any negative effect. And it's for that reason that we put it in the water, even though adults are going to get it, because it really doesn't cause any effect that we can see beyond the good effect with the kids. So if you're an adult and you're going to be going into chemotherapy, or you take a lot of medications that make your mouth dry, or you're on a CPAP machine, When you go to your dental appointment, your hygienist is going to be looking, and your dentist, and what they'll be looking for are some white patches starting kind of around the gums, usually where any sort of bacteria biofilm has accumulated. If it starts to look a bit chalky or white, and you can check this in the mirror yourself, just dry your teeth and look in there. If it's chalky and white, it's a sign of early sort of teeter-totter going the wrong way, and if it continues, then that site may cavitate, and then you have a cavity. So that's where it's like super useful to hit it with everything you can, or brushing, flossing, and fluoride. So I hope that makes sense. If you had any specific questions, definitely ask them. There's just tons of stuff to know, like how do you test your water for fluoride, and yeah, I mean, it's an interesting debate right now. I would like to say this. We are looking into it scientifically. There are concerns that fluoride could cause negative effects. Of course there are, and we're not blind to that as a profession, and we keep studying it. The most recent data that I've been aware of comes out of Alaska. University there in Anchorage published a study about their capital city, where they decided to take fluoride out of the water there. And the difference between the kids in the test group that had water fluoridation growing up and the one's subsequent group, they could track, because it was like an isolated community, and they could sort of say, okay, the kids are going to have this many cavities in this group versus before. And what they found was that there, I think, was a 40% increase in the number of cavities the kids had, just based on that, when you sort of factor in everything else. But even more significantly to parents might be that the cavities that the kids were getting were more advanced. They were deeper and harder to fix, and it actually meant 70% increase in dental costs for those kids, just because they took that 0.04 parts per million out of the water. So it's a very substantial effect, and something to think about seriously before wanting to sort of deny our kids and our communities of that benefit. Anyway, hope you enjoyed that. We're still cruising with the Smart Smiles van, and we're starting to hit up some retirement, independent living sort of places in Peterborough, and that's been a lot of fun. Headed to one tomorrow. So if that's you, give us a shout, and we'll make it happen for you. Have a good day. See you next week.